Hello all, my name is Mark Fisher. I'm chair of the Joint Trade Unions and I'm also chair of Unison. And I just want to discuss today, if possible, a little video about the coronavirus and the impact it has have. First of all, it would be remiss of me not to thank all the staff on behalf of the trade unions for all their hard work, resilience and flexibility they've shown so far, and possibly the most challenging year we've ever had as a council. And I've been in the council a very long time. I don't believe we've ever faced these challenges and hopefully never will face these challenges in the future. What I would need to emphasise, and this is a really important message for everybody, we need to keep this fight up against this coronavirus, both in the work environment and our personal lives. We can't be complacent. It has cost us lives, family members, friends, and it's just not acceptable. And it just makes me angry with the blasé attitude of people. I mean, my experience of coronavirus, unfortunately, I had coronavirus back in 3 days after lockdown. I came back from London, I believe, in my role as a trade unionist. Within a few days, I felt ill, thought I had the cold, went to bed for a few days, thought I could fight it. Unfortunately, being a man, I did not listen to my wife or what was going on, and I thought I'd be okay. Unfortunately, I wasn't okay, which resulted in my wife phoning 999, which resulted in the ambulance coming and actually taking me in 3 days after lockdown for coronavirus symptoms. After 2 days in hospital, being very, very ill, they came and told me I was tested positive and I was one of the few people in the first coronavirus ward in Morrison Hospital. I was the first patient in that ward. I have fantastic care, and after 5 or 6 days in hospital, I'm pleased to say that I managed to get over it and listened to the advice, took the medication, and I came back to work within 3 or 4 weeks. I didn't realise until now that there are long-term effects to coronavirus, and as you see on the news, they are saying that there are long-term problems. Unfortunately, again, I had symptoms which resulted in me a month ago going back into hospital due to complications regarding the original coronavirus. That was down to fatigue, where I couldn't sleep, and I had, unfortunately, minor heart problems and breathing difficulties. So I had a few more days in there, which again reinforced the message and the message I'm trying to get out to every single staff member. I'm 56, I'm not overweight, or a little bit overweight. I don't drink that much, a little bit. I don't smoke, and I exercise as much as I can. And if it can affect me in that way, then I think it can affect every single one of us. And what I do not want staff members is to have this blasé attitude to say, it'll be okay, it won't affect me. Well, I'm sorry to tell you, it can affect anybody. And what I want to do is reinforce the key advice for our staff. Always observe social distancing, regular hand washing, and wear a face covering in public places, particularly out shopping. And I would reinforce this, and I'm in the middle of discussions with the local authority where we are looking to force mandatory face coverings when social distancing can't be met. That's how serious we as trade unions believe. So just please reinforce the local restrictions introduced in September. And like myself, for those who can work from home, remain working from home. There are lots and lots of benefits and positives of working from home. You're in your own environment, and also you're safe. You protect yourself, your colleagues and your family. And obviously, most important, don't leave Neath Talbot area without reasonable excuse if you live here. And the same rules apply across the neighbourhood authority, and only meet indoors with people you live with or your household. And if anyone has symptoms, stay at home and get a test. I really, really want to reinforce that. If you've got any doubt at all, far better to ring the 119 service, seek advice, speak to your line manager and get the test and self-isolate. By you undertaking that will protect yourself, your family and the staff members. And please, please be safe out there. Thank you for listening.